But Donald Trump kept on saying repeatedly that women should tough it out. He kept on coming back to that phrase, tough it out. And people are saying that's really problematic because autism is a very complex disease. It's not very well understood. They believe it's a combination of genetic and environmental factors. But by saying that the woman should tough it out, it suggests that if your child is born with autism, it's because you had some sort of moral failing.
Joining us now is Harriet Alexander. Good morning.
Hello, hi.
What exactly is going on here? It sounds like quite a significant intervention.
Yeah, it's something that's been brewing for quite a long time. And this is very much driven by Robert F. Kennedy Jr., who's the health secretary, and who's someone who's very much known for his opposition to vaccines. And one of his real causes, in addition to vaccines, is autism. And he strongly believes that there is more that the federal government should be doing about autism. So Donald Trump, flanked by RFK Jr., staged this press event, this press conference. It was quite the event. There was mothers of autistic children there as well, several doctors, and he wanted to talk about autism and what he thinks needs to be done.
And in terms of this particular press conference, it was about identifying a link, they say, between something that pregnant mothers do during their pregnancy and ultimately their children having autism. What's the medical proof? What exactly are they saying, and what's the medical proof?
So essentially, what they are saying is that pregnant women should not take paracetamol. And Donald Trump was hammering that home. He kept on saying multiple times, do not take Tylenol. That's the brand name in the United States. It's paracetamol as we know it. Do not take it. I mean, he repeated that, dozens of times. Every now and then he would sort of caveat himself and saying, I'm just making these statements for me, but do not take it, because he feels that there is suggestions that perhaps paracetamol can cause autism in unborn children. Now, the evidence for that, Kate, I mean, is very, very sparse. There is some evidence that taking extremely high levels of paracetamol while you're pregnant can be dangerous. And the manufacturers here in the United States, they've been very quick to say, absolutely, you should not take extremely high levels of this for a long period of time. But it's a very commonly taken drug. And people are now warning that actually a pregnant woman who has a fever and doesn't do anything to treat it, that's actually really risky for blood pressure and for the unborn child. But Donald Trump kept on saying repeatedly that women should tough it out. He kept on coming back to that phrase, tough it out. And people are saying that's really problematic because autism is a very complex disease. It's not very well understood. They believe it's a combination of genetic and environmental factors. But by saying that the woman should tough it out, it suggests that if your child is born with autism, it's because you had some sort of moral failing.
And it wasn't the only element of this health advice the president was giving. There was also some recommendations in there about vaccination.
That's right. Yeah. So he was also talking about he doesn't believe that babies should be given a hepatitis B vaccine when they are born. He said repeatedly, a hepatitis B vaccine is for a sexually transmitted disease, which actually is factually incorrect, because sure, that's part of it, but for newborns, of course, it's not for that. It's because there can be the virus which will cause liver disease and cancer, and it can be transmitted from the mother to the child during birth. And unless there's been a range of tests, you won't know. So that's why the child is given the vaccine immediately. And he also talked about separating the MMR vaccine. He was sort of riffing off this, just saying, to my mind, they should be given separately. He said children are given over 80 vaccines, and it's like pumping drugs into a horse. And he said that it was not wise at all.
And this, I mean, how's it been received so far? You touched on the idea that the drug companies have come out and said, yes, of course, you shouldn't be taking high levels of paracetamol during pregnancy. But what's been the reaction more broadly to what Donald Trump is saying? Are people believing him? Are they jumping on board straight away?
I think that there's been a range of responses to it. I mean, I think a lot of expectant mothers are probably pretty concerned about this. I mean, if you had taken paracetamol in the past few months during your pregnancy, you might be very worried about this, about what it means, which is an awful thing. Medical experts are really pushing back on this, saying that there is absolutely no new evidence that warranted this press conference. That there wasn't a new study to announce. It's just a reassessment of existing science, and even that is not very settled. And some people have been saying it's really unethical for the president just to stand up there and riff on this without actually having the science settled and to make medical recommendations. It reminded a lot of people of during the height of the pandemic, when, of course, Donald Trump was suggesting all sorts of things like injecting bleach and that type of thing. You know, it felt very kind of wild and quite unruly what he was doing.
And finally, Harriet, I mean, that I suppose that's the question. What exactly is going on here politically? I mean, we know that the health secretary has, taken a hard line on vaccination, but what's the broader, what's really behind this? What's behind this intervention from Trump?
Well, I think there's two things to say on that. I mean, firstly, it absolutely is true that there is an increase, a significant increase in the number of cases of autism that are being diagnosed. It's a 300% increase in the last 20 years. But most experts say that that is down to two things. Firstly, the fact that there are a lot more screenings being done than there were decades ago. And also the definition now for what actually counts as autism is a lot broader than it used to be. So that's why you're getting more cases diagnosed rather than there being an epidemic of autism, which is what Trump likes to talk about. A lot of experts don't like that terminology at all. So that's part of it. But I think the broader issue is this reevaluation of decades of settled medicine establishment thinking. Robert F. Kennedy Jr. was very much brought in to shake things up. Some of what he's doing is actually quite popular in terms of looking at additives in food and the diet of Americans, you know, obesity, which is something which really is a problem in this
Yeah.
country. But other things like trying to blow up the vaccination system, that's something that's much, much more controversial. And I think this very much fell into that latter case.
Harriet, thank you so much for your time. We really appreciate it.
Thank you.